Are you a clinician looking to learn how to provide ultrasound-guided procedures for your patients, but you were never formally trained? Are you a training institution looking to increase the amount of hands-on time with a needle students get prior to their first day in clinicals? Is July closer than you initially thought? If this sounds familiar, then ultrasound red goo phantoms are for you. Do you need to provide ultrasound-guided central line training and education, but struggle to find a phantom that is simple to set up, small enough to facilitate easy storage, and budget responsible? This is where the ultrasound red goo central line phantom can help. Our phantoms are produced with a complex, long-lasting tissue-mimicking material that will require refrigeration after use and can stay out of the fridge for several hours. The phantoms are highly durable, compact, and budget responsible. Ultrasound red goo makes ultrasound phantoms. Phantoms are medical models or simulators that allow clinicians to view mimicked internal structures within an ultrasound machine and place a needle into it. Some phantoms are high fidelity and resemble one instance of human anatomy. These phantoms often cost between $5,000 and $10,000 and do not allow the provider to gain very much experience with multiple instances of human anatomy. You'll need to scan people for that. Ultrasound red goo makes low-fidelity phantoms that offer a reasonable alternative to these expensive products and still allow the clinician to gain the skill they need to become proficient ultrasound proceduralists and one day experts. Low-fidelity phantoms have demonstrated similar educational benefits when compared to high-fidelity phantoms. Now you can ask me about that. Also, they scan better than many high-fidelity phantoms, even with high-frequency probes. The ultrasound red goo central line phantom is a high-quality, low-fidelity phantom designed to help train clinicians in the skills of scanning, needle insertion, and wire advancement and catheter placement. I recommend using a 20-gauge catheter over wire system to maintain the phantom for hundreds of insertions. Needle contact with the desired anatomical structure is a paramount skill when placing a central line. Failure to do so can result in mechanical complications such as pneumothorax, hemothorax, arterial puncture, and line failure. Mechanical complications are reported to occur in 5 to 19% of patients who receive a central line in the United States. The proper use of ultrasound can reduce mechanical complications by up to 71% and reduce line failures by 12%. This is nothing new. But are you sending your students and trainees into their first clinical experiences with the needle contact skill they need to deliver safe, invasive procedures, or are they just getting an overview of central venous catheterization and a few attempts in the sim lab on an expensive, high-fidelity simulator followed by on-the-job training? The ultrasound red goo phantom central line trainer has 4 venous targets that are approximately 18 inches long. This allows for the practice of scanning in and out of plane, the catheterization of the vessel, and the insertion of a wire and small bore catheter over wire like a triple lumen catheter, which is so common in the ICU. In testing, each of these vessels withstood over 50 cannulations. Now that's less than $1 per cannulation for your students or yourself. Let's see some of the exciting things we can learn how to do now using the phantom. With the low cost and quick setup time, it is now possible to allow trainees to stick as many times as they want or until they achieve mastery with a time and monetary cost that is reasonable. You can even do something you would never consider doing with a high-cost fidelity simulator. Leave the trainee unattended with it. High-fidelity simulators allow for the scanning of replicated anatomical configurations. These configurations are often composites of thousands of anatomies that the manufacturer has painstakingly scrutinized over. But at the end of the day, the several $1,000 phantom affords the trainee just one anatomical configuration to scan. This is why sticking many times with the low-fidelity phantom to own the skill of needle contact, followed by scanning many live subjects, perhaps classmates, makes sense economically and for a superior educational experience. Practicing image optimization, scanning, and needle contact and approximation on an ultrasound red goo phantom target will give you, as a clinician or your students, the confidence and ability they demand to provide your patients with the precise ultrasound-guided procedures they require. Get yours today at www.ultrasoundredgoo.com.